Assalamualaikum warahmatullahi wabarakatuh. My name is Bertalia. I come from Gunadarma University, Jakarta, Indonesia. I would like to present our paper for 2020 First Conference on Internet of Things and Embedded Intelligence, or CITEI 2020. Our paper is entitled Formulation of City Health Development Index using Data Mining. The authors of this paper are Bertalia, Prihandoko, Lili Setiawati, Febrian Ikhtikar Irawan, and Sahifa Rahmita Ilianti. Our research is motivated by the use of health indicators to measure public health. There are three pillars of the Human Development Index. It's first, education; second, increasing the purchasing power of the community; and third, health. Indicator of health in the Human Development Index is life expectancy, but public health cannot be measured just by life expectancy. There are many other indicators that influence public health. So that's why Health Research and Development Agency, the Indonesian Ministry of Health, compiles the Public Health Development Index, or we call that PHDI. The PHDI is a collection of health indicators that can be easily and directly measured to describe health conditions in a city or region. This PHDI can be used to see the results of the previous year's health development and can also be used to plan health development in the coming year. The PHDI measurement uses data from the Public Health Research, the National Socio-Economic Survey, and the Village Potential Survey. These are conducted every 5 years by conducting a survey to retrieve data. The last model of PHDI measurement that used is PHDI 2013 model. This model uses 30 indicators which are divided into 7 categories. First, toddler health; second, reproductive health; third, health services; fourth, health behavior; fifth, non-communicable diseases; sixth, infectious diseases; seventh, environmental health. The problem is, every year the provincial and city health offices in Indonesia publish health profile data for each region based on reports from the health sector in each region. This health profile data is collected from population health measurement results from the community health centers and the health program section at the health office at both the city and provincial levels. This health profile data contains data and information that illustrates the degree of health, health efforts, and health resources, and the achievement of health development indicators in certain areas. The main problem is that city health office could not have any information about the level of city health condition. This is because they don't have any formula to measure the city health index based on the city health profile that they produce every year as an annual report. Our proposed solution is to use the city health profile data generated annually to measure the City Health Development Index, or we call it CHDI, in each region. The formula for measuring the CHDI adopts the PHDI 2013 model. The indicators for the formula obtained from the process of data mining. The steps of our research consist of the process of data mining and calculating the CHDI score. The process of data mining consists of merging of health profile data, data cleaning and selection, data transformation, and data classification to obtain the important attributes. Then the important attributes are used in calculating the CHDI score, but first we determine the weight of each attribute. This is city health profile data that we use in our research. This data is merging of health profile data of the provinces of Bali, DKI Jakarta, di Yogyakarta, and Sulawesi Tengah in 2017. This data table consists of approximately 710 attributes. In the process of data cleaning and selection, the health profile data table is cleared by removing attributes that are empty or inconsistent, so that only 57 attributes are left out of the 8 indicators. These 57 attributes are denoted as A1 to A57. In the next process, data values are then normalized by dividing its attribute value by the population in the area and multiplying by 10. In the process of data classification, we use decision tree, C5.0, and random forest technique. Each attribute will be classified into certain groups so that the most dominant attribute involvement can be identified to get the weight that will determine in the calculation of CHDI score. The calculation is done using R programming. This is the graph of classification research with random forest algorithm. Based on the graph, its attribute weight be determined with the following condition. If x smaller 0.1, then the weight is 1. If x is greater than 0.1 and smaller 0.2, then the weight is 2. If x is greater than 0.2 and smaller 0.3, then the weight is 3. If x is greater than 0.3 and smaller 0.4, then the weight is 4. If x is greater than 0.4, then the weight is 5. The formulation of CHDI refers to the calculation of the PHDI 2013 model. First, calculate the weight proportion of each indicator in one group, then calculate the index of each group of indicators by adding up the result of the multiplication of the indicator index value by the proportion of weight in one group. After obtaining 6 index values for the indicator group, then proceed with calculating CHDI score. We can see this table illustrating the simulation result of the CHDI measurement for provinces of DKI Jakarta, di Yogyakarta, Sulawesi Tengah, and Bali. The conclusion of our research is the CHDI formulation was successfully formulated by adopting the PHDI 2013 model and using indicators from city health profile produced annually by each city. These indicators carry out by using data mining technique with random forest algorithm. The CHDI formula has been examined and analyzed by comparing the scores with that of PHDI scores. The result shows that the difference between PHDI and CHDI is not significantly big in terms of the scores and the cities they are measured. This means that CHDI formula can be used by city health office in creating annual program planning of their city health. Thank you. Terima kasih.